KBOI2 News, first at 4.
The last bill still standing at the Idaho legislature that addresses the health care gap continues to undergo change.
As a matter of fact, just an hour ago, the Senate passed a new version, which is headed back to the House. Sierra Oshwin has been tracking this bill. She's live at the State House to begin our legislative watch.
Brett and Natalie, it's been a lot of back and forth here at the State House with the health care gap dominating the last few days of the legislature. There's just one bill in the works right now regarding closing the health care gap, and the Senate just added some new language to it. The bill would provide a $5 million a year grant to clinics for the next 2 years to help uninsured working poor in our state. But the Senate added new language to start the process for a Medicaid waiver from the federal government next session. That would allow the state to develop its own health insurance program using federal Medicaid dollars. I just spoke with the president of the Senate, who says that he thinks it's possible that the bill could return back to the House floor today. The House has to agree on this new wording that the Senate just approved, but it's unclear just when that will happen. The legislator is trying to wrap up either today or tomorrow. Reporting live from the State House, Sierra Oshwin, KBOI2 News.
A different Republican proposal aimed at addressing the health care gap died this morning in the Senate Health and Welfare Committee. It would have used $400,000 for a study of the population within the gap. Skeptics said they already know enough about those in the gap. Backers had said a committee would have examined the possibility of creating a waiver.
There have been committees to look at this issue. Of course, the Governor's Committee, Health and Welfare, has been studying this for a long time, but this body has not had a specific focused group to look at a waiver and what that might entail.
The bill was voted down unanimously.
As the health care debate grinds on in the last hours of the legislature, some of those who live in the health care gap spoke out at the Capitol today.
They are the people, 78,000 of them, who cannot afford adequate health insurance but make too much to qualify for health care subsidies. Scott Logan has one woman's story.
Shelley Glue of Nampa is one of 78,000 Idahoans in the health care gap. She says her husband endures an agonizing illness and mounting medical bills are dragging her family down.
He suffers every day. Recently, my young daughter started to exhibit these symptoms. They're eerily similar to her father's. Listening to a child scream in pain is a hellish torture.
And she says she's angry lawmakers are not providing substantial help this session to Idaho's underinsured working poor.
I'm a tough woman, but when I heard that once again they were not going to close the coverage gap, I crumbled. I cried in frustration. I cried because 78,000 people will continue to suffer and some will die. Our legislature does not care. What they proposed was a slap in the face. It will not prevent suffering. We need to expand Medicaid.
And a doctor from eastern Idaho shared her anger and urged lawmakers to act.
Do the honorable thing. Do not leave Boise with blood on your hands.
Many lawmakers will soon be going from the State House to the campaign trail for the May primary election. They can expect that the issue of health care will follow them every step of the way. Scott Logan, KBOI2 News, the State House.
Again, the legislature is trying to wrap up the session by tonight or tomorrow. The House still needs to approve the changes the Senate made to the health care gap bill before it can go to the governor's desk.
The Idaho Senate also passed a measure aimed at reducing Idaho's corporate and income taxes. The measure would establish an interim committee to review Idaho's tax system and report its findings during next year's legislative session. The House is debating that today.
4 unhappy Democrats skipped a committee meeting today, saying it wasn't worth their time. The meeting addressed a bill that would make it illegal to harvest fetal organs or tissue. The Democrats called the meeting an attack on Planned Parenthood and women's rights.
Before the committee today is a fraud. It is fraudulent to use our time here to run special interest bills that are in bad public policy.
If we can't even close the health care gap for 78,000 Idahoans and we're going to waste our time and taxpayers' money on this, we will not attend it. And I don't want to end my session on a terrible note in that way.
The lawmakers want legislation to focus instead on closing the health care gap, increasing the minimum wage, protecting public lands, and investing in education.